Hello, good evening, and welcome to your favorite medical show, Ask Dr. Saw. The feedback that we've been getting is just amazing, and we're here again live tonight. And without Dr. Saw himself, this show would not be here. So, Dr. Saw, how was your week so far?
Oh, good, thank you.
Yeah.
Yeah, not too bad. Just routine stuff.
As I asked, this is your first Diwali back here in Guyana after a long time.
Yes, I don't think it's been a while since I celebrated Diwali in Ghana.
Looking
So
forward,
I'm looking forward to that, yeah.
Yeah, all right.
The
Nice.
motorcade and all of that.
Yeah,
Yeah.
indeed. So, again, this show comes to you every Tuesday at 8 o'clock, and the aim of the show is to give you a platform where you can call in and ask Dr. Saw about medical conditions or ailments or so, and he will answer, as he always says, to the best of his ability. I want to say that I met a gentleman the other day, last week, Saturday. I met a man, he's in his 80s, Asgar. Asgar used to work with a Medicare had a distribution center in Bel Air.
Yes.
With David Bacchus. And Asgar Ali's his name. He's in his 80s. He worked there as a salesman. He sold. I used to tell him he sells drugs, right? And Asgar, if you're watching, thanks for the compliment the other day. Asgar met me and he said that he loves this show, and he's in his 80s and he's still driving and moving around and so on. Asgar is in Kingston. Yes. So we really appreciate everybody. The comments and your message and the questions that you ask online. If you don't get a call, it really means a lot to us. So thanks again for joining us. We are coming to you live. This is the last Tuesday in October, and October has been dedicated to breast cancer awareness. And there were a number of programs across Guyana where I see where awareness is being spread, and people went out in their numbers to support. There was a massive cancer walk, and when I saw the amount of people out there, I know that it's for a good cause, and people are getting aware. So tonight we still want to continue with talking a little bit about cancer, and we're gonna just do a little bit, Doc. If you can probably do a little bit of a recap as to what we covered last week and what is it that you would like to talk about this week?
Sure. So, as you know, cancer is a big subject, and I didn't think that we could do it on one episode. In one episode, we wouldn't do justice to cancer if we were to just spend 1 hour talking about it. So I feel that given the awareness and the month of October, breast cancer awareness, I feel that we should use that opportunity to also, talk about other cancer and raise awareness. Just to recap, the intention of last week was to talk a bit about some screening that we have for cancer, and we talked about what are the screening programs that they have worldwide, and Guyana, of course, has got those screening programs as well. So we have breast cancer screening, and in breast cancer screening, it's in the form of what is called mammography, so mammogram, like a special type of X-ray of the breast. If you find abnormality there, you can do further testing of the breast as well. Patients can have ultrasound of the breast. They can have MRI of the breast. So those are other modalities that can be used. But we have breast screening as a national program. The other screening that we have is cervical cancer screening. So cervical cancer screening is the mouth of the uterus, is the cervix. And they have a screening program for that. Also, there is a prevention program in terms of there is a virus that is linked to cervical cancer. It's called the HPV virus, and we have vaccination. So I would encourage and ask everybody who's eligible to have the vaccine for HPV virus, and it prevents cancer.
Just a point to note, Doc. There was a drive in Guyana recently to have young people get vaccinated against HPV, human papillomavirus.
Correct, that's it.
Yeah.
So it's an ongoing program.
Yeah.
I mean, so once you reach that age, you'll continue having HPV vaccine.
And if I may ask, is it mostly young women should have it, or?
Well, usually the intention is to have it before you're sexually active.
Okay.
So for you to get HPV, that virus, it is spread by sexual contact. And so the intention is for you to be immune before you're sexually active. So I don't know what age to give it in Ghana, maybe 15, 16. So, before that age. I mean, abroad in England, we do it at 14. But there are different policies, different countries. They start different age.
Yeah, Doc. Sometimes I may look away from you to look at the screen. It may seem rude to yourself and the viewers, but I'm just trying to see who are asking questions so that we can get the questions off the screen here also.
Sure. No, indeed.
I see someone ask a question here in Spanish. I will try my best to see how I can translate that
in Spanish. Yeah.
Well, I'll have to use a Google Translator.
That's fine.
But yeah. But yeah,
okay, yeah. So coming to that. So so we have your cervical screening, and then they have colorectal screening. That is for bowel cancer. So colorectal screening is where you can have the stool test done, so the poo test to check for blood or blood products, and if that is positive, you go on to have a colonoscopy, which is a camera in the bowel. And I know in the US they do colonoscopy straight away, and then subsequently the stool test.
Okay.
Now, so that is talking about screening. For men, the screening that we do is a PSA. As I said, the PSA test has got, it doesn't pick up all or that because it's positive. It means that you have cancer, but it's good enough screening for now because there is no alternative. There are other tests you can do once it is positive. You will then confirm if it is or it is not. Then you will have things like MRI scanning, and then you can have a biopsy to confirm if it is cancer or not. But today I feel that we should go on to talk a little bit more about the different other types of cancer and what are some of the common symptoms. So when are we worried? Because as I said the last time, and we all know this, cancer, if we pick it up early, sometimes it's curable. Curable, that means you won't get it again.
Right.
So the longer you wait to diagnose cancer, where the cancer spreads to other part of the body, that is called metastasis, then it becomes harder to treat. Most of the time when you have metastatic cancer, it is not anymore curable. It is just prolonging life. So you're having medication just to, extend your life. So that is when you have metastatic cancer, or people who say stage 4 cancer. It spreads to different organ of the body. So I told you the definition is when a part of the cancer is when that cell grow in a haphazard and erratic way, and that cell can invade other parts of the body. But let us just talk a little bit on the other types of cancer. So if we go on, I normally like to start in a systematic way, so we can start with the head. So brain cancer. So if we say, when are we worried that you have brain cancer is also, it's a when people say they have tumor of the brain. So a tumor does not necessarily mean it's cancer. Tumor just means a mass.
Okay.
So a tumor can be a benign tumor. That is, it is not cancerous. Cancer means it is aggressive, it is growing, and it is spreading rapidly. It is spreading. It's growing and expanding. But you can have a benign mass, like a little lump. Sometimes you have little bumps and lumps. You can say that's a tumor, but it is not cancerous. So that's to draw the distinction. So you can have cancer of the brain. So you can have aggressive tumor of the brain, a cancerous tumor of the brain. Now, because the brain is a compartment that is enclosed in the skull, if something is growing there, what will happen eventually? It presses on the brain tissue itself.
Right.
So you can have, the common things we look for would be headaches, right? So probably that's the most common symptom of brain tumor. You have headaches. We will do a special topic. I want to do a special topic on headaches because there are so many different types of headaches, like migraine and tension headache and cluster headaches and all of that. But if we're having headaches there are certain patterns we look for. So the story about a headache tells you a lot sometimes. What diagnosis it is. So classically, cancer headache. Tumor headaches tend to be where the pressure in the brain is high as the tumor grows, and you tend to get a headache in the morning when you wake up or when you lie down. Because when you stand, the pressure drops, but when you lie down, the pressure increases. So patients wake up, they have morning headache. So anyone wakes up with headache in the morning, we would take that, we would look at that seriously and say, okay, we need to exclude cancer as a cause. That is if you don't have any other symptom to suggest other types of headaches. You can have nausea or vomiting, so you feel sick and you vomit. you can have then what we call neurological symptoms. So cancer can present like stroke. So you have weakness in one part of the body, you have numbness, you have tingling, you can have visual symptoms, you can have slurred speech. That is when the tumor presses in part of the brain. So it presents like a stroke, generally.
And it's incapacitating certain
Yeah.
responses.
Some people also can have, they just have got patients who just wake up in the morning. I mean, they just experience an episode of seizure. First off, seizure. We did a scan, it's a tumor of the brain. So you can have all these presentation, neurological presentation. I always say to patients, and also mood changes. So if somebody normal and suddenly you see they have some type of psychotic symptoms or personality change that is dramatic. Yes, of course, it could be a psychiatric condition, but we should not just label that person psychiatric to say the diagnosis is indeed a psychiatric condition. And however, we should start thinking, could this be cancer as well? Right? So it's just an index of suspicion. You should have a high index of suspicion and with certain symptoms. So that is in summary if we're talking about brain cancer. Let us go down now. Let's look at head and neck. So head and neck cancer usually would present with lump, a mass. So if you have a swelling of the neck that is increasing in size, of course, we want to check that that's not cancer. So you see a doctor, you have a scan, there are other things we can do. So if we see a mass and we don't know the nature of it, you can do a scan and then you know if it's a solid mass or if it's a cyst, like a cyst where there's fluid in it.
Yeah.
And usually the fluid masses are not cancerous generally. If it's a solid mass and you want to know more detail, you can stick a needle in it and take a sample, test it in the lab. So different ways of understanding that. So head and neck cancer. There are lots of time in the throat cancer, you can have problems swallowing, you can have problem with your voice. So anyone who's got a sudden change in voice that is persistent. Now, I just want to make this clear that not all symptoms, when you have symptoms, I always say to patient, if you have a symptom for a week, don't think cancer. Don't just worry about it, that everything, because everything under the sun can lead, can be an indication that yes, it's cancerous if it's persistent. But I don't want patients to start, as soon as I get a hoarse throat, I say, I've got cancer. Don't ever do that.
Yeah.
You would have to know, I have a hoarse throat because I have a sore throat or I have cough and cold. They're related. But let's say you have a change in voice for no reason, and you have other symptoms, difficulty swallowing, then of course, and it's going on for months, don't sit on it. After 6 weeks of any symptom, please, 4 to 6 weeks of a symptom that's persistent, most viral infection, within a month should be okay. You should be cured of that. But anything that persists, you want to check that out. And then we come to the chest, we talk about the lung cancer. Anybody with a chronic cough, always get it checked, ensure it's not lung cancer. So chronic cough, but the hallmark also we look for, cough with productive cough that with blood stain. So if you coughing up blood, besides TB, cancer is another cause, and you tend to have weight loss. So if you're coughing persistently, you're losing weight, also you may have night sweats, with or without blood, you always want to make sure it's not cancer. And of course, chronic infection as well can do that. Upper GI cancer, that is in the stomach. You can get cancer of the stomach as well. That would lead to problems with indigestion. You feel sick. Probably you have problems swallowing. The food doesn't go down. And of course, again, you lose a lot of weight. So weight loss, upper GI cancer, lung cancer tend to give lots of weight loss. As we go down further, pancreatic cancer.
Well, just to say that somebody just asked about asked a little earlier in the comments about pancreatic cancer, to say a little bit about pancreatic cancer.
Oh, right, yes. Yeah. So pancreatic cancer is one of these elusive cancers.
That's right there, yes.
Yeah. Now, the pancreas is a digestive organ that produces digestive juice to digest your food, and also it produces insulin. The pancreas produces insulin for your, sugar control. So you can have a mass, or what it is something growing in the pancreas, and the the thing about pancreas cancer, why sometimes the 5-year survival is very low, is because you tend to pick it up very late. So by the time you start expressing signs and symptoms of pancreatic cancer, the cancer have advanced. But classically, anyone who has got, so you'll get epigastric pain, that is stomach pain. So if you get pain, weight loss, change of bowel habit, or digestive symptom, I'm feeling sick, nausea, vomiting. So these are the classical symptoms. But weight loss is very, we tend to take that seriously. Anyone with weight loss, I always go looking for cancer. If you have unexplained weight loss, so we're not talking about a person who is trying to lose weight and exercise and diet.
right,
We're talking about unexplained weight loss. But pancreatic cancer would give rise to symptom of epigastric pain. You can get back pain also with it, and weight loss and change in bowel habit, digestive symptoms. How do we diagnose that? A scan can tell us that. So we can do, there are different scans you could do. You could do MRI, CT, ultrasound, different scans we could do. Now, coming down lower than that, what we have, colorectal cancer. We talk a bit about that. Colorectal cancer is where cancer in the bowel, usually the large bowel, and that would present with rectal bleeding. So anyone who's got unexplained bleeding from the back passage, and also especially if they're losing weight, if they've got a change in bowel habit, you want to make sure it's not cancerous. And in women, you also have ovarian cancer and uterine cancer. So ovarian cancer would be the ovaries. You would have a mass in the ovary. Lots of time patients will present with abdominal pain, bloating, and then, of course, you would go investigate in ultrasound scan. There's some tumor markers we can do as well for that. And in uterine cancer, that's the uterus. You tend to have bleeding. So anyone who's postmenopausal, so a woman who who stop having their period, so we call it menopause. If you have bleeding postmenopausally, you should always be investigated for cancer. That's a general rule. So, that's important. So I think in summary, what other cancer we've missed? We talked about skin cancer before. So a mole, there are different types of skin cancer. You could get a rash that doesn't heal, and we want to, if it's expanding, it doesn't heal. You can have that presenting that can be cancerous, like we call it squamous cell carcinoma or basal cell carcinoma. But the most common type of, cancer that lots of people know about, when they have a mole, they say, okay, this mole looks cancerous. So that's called a melanoma.
Okay.
And that's a mole type of cancer. So where the pigment, it's like a mole, but it's got irregular border, it's bigger, and it's different color in the mole. And also you have soft tissue tumor, and that's they're usually aggressive tumor. So if you have a lump, a mass, so let's say your muscle can have cancer, you would present with a mass, like, you'd look at one part of the body is swollen, the other part is not. Yeah. Especially if it's aggressive and it's growing rapidly, you should get that checked out.
Doc, I want to ask about another. When I was growing up, I used to hear about somebody, people say blood cancer.
All right. I need to touch on that.
Yeah. So, what is blood cancer?
So we know that blood. So in children, that's the most common cancer. So we talk about breast cancer in women. We talk about prostate cancer in men. In children, blood cancer would be the most common cancer. So what is blood cancer? The most common blood cancer would be leukemias and lymphomas. So your white blood cell. I told you that you have red blood cell, you have white blood cell, and then you have some protein in the blood. And the common types of cancer would be cancer of the white blood cell. So you heard of leukemia and lymphomas. You heard of that? Have you?
Right.
Right. So what tend to happen, the white cell, if you were to do a blood count, so the symptoms generally, children especially will get it. Adults can get it as well. Patients tend to be anemic. They may have fever, and they may have bone pain. So any child who complains of pain in the bone, they are fatigued, because you tend to be anemic. What tend to happen, the white blood cell invaded the bone marrow and suppressed the other types of cell. So your red blood cell is suppressed, so you become anemic. You may have bleeding. So a child who's got low platelets, that would suppress all the components of the blood because the white cell has gone erratic. They start growing abnormally and they're taking over the bone marrow, for instance. And then you would have high white blood cell with low. But these types of cancer, if you pick them up early, they're well treated, they're, curable.
Yeah, Doc, a lot of questions are coming in already. And just to let you guys know that the lines are open, you can call also. It's 231-2982, 610-1066, and 652-1314. So, Doc, I got some questions here that came. First question is, how often one can take a mammogram? Or how often one should take a mammogram?
In the US, for instance, they do it in the beginning, once a year, then 2 yearly. In the UK, we do it 3 yearly. So in the UK, we start at 50. Now, I just saw an article published in the US where they want to start at 40. So the recommendation now is to start at 40. I think they used to start at 45, but they started 40, and initially yearly. They're recommending 2 yearly now, and in the UK we do 3 yearly. So different country have got a different protocol.
Okay. Let me get the other question here now. It says, that's the pancreatic cancer. So you spoke about that. Somebody wants to know where. Can I ask where this doctor's office is located?
At the moment, I'm at Woodlands Hospital, Monday, Wednesday, and Friday.
Monday, Wednesdays, Fridays at Woodlands Hospital. And this person says, I think it will be helpful when persons are diagnosed with serious conditions such as neurological disease that doctors here can recommend counseling for those individuals, how to cope and better understand their conditions. Do you agree?
I totally agree with that. Now, half of the time, when we define health, we talk about mental, social, and physical well-being, not just the mere absence of disease. So you can say, fine, someone is, we look for physical thing and say if you're healthy or not healthy, but mentally we want, if you cannot, when you have a disease, a diagnosis of serious health condition, it takes a toll on your health. Mentally, you don't sleep well.
That's right.
You're stressing all the time. You're lots of things going through your head, especially if you have young children, you have family, you have, so I think it is very, very important. That's a very good point. We would always encourage counseling, and they have psychotherapists. Generally, we would refer all our cancer patients for counseling.
Yeah. Well, thank you so much for that, viewer. Can you explain enlarged prostate?
Yeah. Okay. So enlarged prostate is the most common enlarged prostate. Is what is called BPH. Benign prostatic hyperplasia. So as you get older, so I explained the last time that the prostate is a gland like a walnut at the bottom of the bladder, right? But the neck of the bladder. So your bladder is, let's say this is your bladder with urine inside. The corcate, for instance, will be the prostate gland. And the tubing goes through there. So as the prostate grows, as you get older, it grows and it expands. And what it does, so if you have, I don't know if the camera can see this. So this is let's say this is the gland. This is your
Probably put him alone on. Yeah, put Doc alone on.
Okay. This is a tube that
you're right.
So this is a tube that you pass in the urine through. It's called the urethra, and your bladder is here, for instance, with urine. So it got to flow through here. So if this gland is getting bigger, it doesn't get bigger outwardly only, but inwardly as well. And when it gets bigger, it squeezes the prostate and the urethra.
Right.
So your flow of urine now, you'll get an obstruction to the flow. So initially, you may start to dribble. So you go to pass urine, you pass a little, you may take a long time. So we describe that as hesitancy. So you take a long time to start. Once you start, the stream is poor, so you may stop, then you start again. And you may empty your bladder, you think you finish, and then 5 minutes after you want to go again. So because the prostate blocks the flow, you stop passing urine, you go back, but the bladder is not fully emptied, and you have to go again. So the most common cause is called benign prostatic hypertrophy, and that happens naturally as we get older in men. So I would say, so that's not cancer. That is just an enlargement of the prostate. So there are a few things we would do. How do we manage it? Generally, we will start with medication to relax the muscles around the prostate. So it relaxes the muscles so it doesn't squeeze so tight and you get a better flow. We would also give you a tablet that blocks your hormone. Remember, your prostate grows by stimulation of the male hormone. It causes enlargement of the prostate. So the prostate is getting very big. We may want to give you a hormone to block your hormone so it doesn't cause growth of the prostate. The downside to that, however, it can also cause low libido because you're blocking your male hormone. So that's your medical management. If it fails, if medical management fails, then you can have surgical treatment. And what does surgical treatment involve? There are various methods now. You can do surgery. You can put a tube into the urethra from the penis, and you can scrape away that prostate. So they just scrape away and expand the opening. Right?
Okay.
So it's called TORP, transurethral resection of the prostate. Now they have laser they can use. And they can do that. They have lots of other techniques, surgical techniques, where they could put, strings and tie it off and pull it up towards the capsule. So there are lots of surgical management for enlarged prostate. Now, cancer of the prostate, on the other hand, is a little bit different. It's an area of the prostate that has got cancer cells that they tend to grow and expand. And of course, it can give you similar symptoms like enlarged prostate, because of course the cancer is growing, but the danger also is that the cancer can leave the prostate and spread to other organ of the body, especially the bone, and that is when you have what we call metastatic cancer.
Okay, well, that's a lot. Okay, so this person, doctor, so I had both my thyroids removed because the doctor did a throat biopsy and saw a spot on my left side thyroid. So I took both out. I never had any signs or symptoms. So if I'm to understand what this person is saying is that they never had any signs or symptoms.
Sure.
But they were told that. So are there signs and symptoms that people should look for?
Yeah. So thyroid cancer generally, you'll have a lump in your thyroid. So the thyroid gland is in the neck, and you may feel a lump in the thyroid. That's a common presentation because it's a difficult one, thyroid cancer, indeed, because the gland is under here, under the skin and muscles under there. So you can have a little lump growing and you don't know. And it can go inwardly, so you don't see it protruding outwardly. So, yes. Now, if you do a scan and you find a thyroid lump, there are certain things we would do. We will go and put a needle in. So you scan it first, you find where the lump is, and under guidance of an ultrasound, they stick a needle in to take some cells out. If it's confirmed that it's cancerous, then we will remove the gland. You not just remove that lump,
the entire gland.
You remove the entire gland. So what tends to happen now, the patient then become hypothyroid because they don't have a thyroid gland. That is no thyroxine being produced, and then we give them thyroxine tablet.
Okay.
So that's usually the treatment for cancer of the thyroid.
This person says, "Good night, doctor. I have numbness in my leg and hand."
All right. So numbness again. It many reasons. You can have numbness for many reasons. So when we describe numbness, a feeling, you're thinking right away this has to do with nerve, right? For you to feel something, it has to go through the body in a nerve impulse, and the brain will interpret it. So if I have numbness, it means I'm not feeling. It means the nerve is damaged. That's the common thing, right? However, why the nerve is damaged? The nerve can be damaged for various reasons. You can have diabetes and the nerve is damaged. You can have an injury. If I hit my elbow and you get a feeling where you get that pins.
Yeah, that's right. Yeah.
That's a nerve being traumatized there.
Yeah.
But let's say the nerve is trapped in the bone here. Your nerve can get trapped. So this person, where's the numbness in hand?
Yeah, hand and leg.
Hand and leg.
Yeah.
So if it is one side of the body, I would be more looking for causes, in the spine and the brain, neurological causes. If it is localized, remember the body is like a circuit wiring diagram. So if I have numbness in this part, I'm looking, if the nerve supply just this part, It can be affected from the wrist. It can be affected from the elbow. It can be affected from the shoulder, from the neck, from the brain. So you always look at the circuit as to how the nerve travels, and it can be affected anywhere. So if you say it's localized to one area, if you have generalized numbness that is moving around now, we want to make sure it is not something called MS, multiple sclerosis. You want to, look for that. So that's a degenerative condition of the brain. But it's difficult. However, it could be innocent, that the numbness, if you sleep awkwardly sometime, you wake up and you press on the nerve, you could get numbness, and then as the day progresses, it gets better. You could get numbness because it's a manifestation of stroke. And when you have transient ischemic attack, you can get numbness that disappear within 24 hours, and that's a TIA, which is a mini stroke. Numbness can stay for days and weeks, and then you say that's a stroke. So there are different reasons. I would need to get some more information. If that person can call in and maybe I'll ask a couple of questions.
The person with it says that that you're having numbness in the legs and arms. If you can call in, you probably can ask Doc. You can give a little bit more detail. Doc, I want to ask you this here: numbness in the extremities, of course. Could it be caused by the excessive usage of, let's say the strong detergents and so on? Could it damage the nerve endings in your hand?
Very unlikely. For detergent and chemical stuff, they can damage the nerve endings indeed over long periods.
Okay.
But before they do that, I would expect you to have some skin condition, dermatitis.
Okay.
It would irritate the skin. You may have a skin rash. You may have that before the nerve is affected. And you have to have prolonged use for it to damage the nerve. There are some toxic chemical and things like lead, mercury that can damage your nerves permanently, and that can give rise to numbness. Also, if you're low in vitamins, vitamin B12, you can get numbness and nerve can be affected. So there are various...
there is this person is asking this specific question here, and before I got this word wrong...
Let me see. Pericardic. So I will say, do you deal with pericarditis? So that should have been, pericardium is a covering of the heart.
Okay.
So you can have inflammation of the heart, which is called pericarditis. So I think that's what they're alluding to, pericarditis. So the heart has got a fibrous covering,
right,
and that's called the pericardium. And if it is inflamed, you get pericarditis. Now, what can cause inflammation? Infection can cause inflammation. Some autoimmune condition where the body attacks itself. So generally, it's a type of inflammation in the covering of the heart.
Okay. Doc, if you have infection in your blood and is in your whole body, what causes this?
Oh, that is serious. If you have infection, the blood's supposed to be sterile. That is, no infection, no germ should be in your blood. Now, infection of the blood is that's called sepsis, and that is serious.
This could be fatal.
Yeah. However, you can have infection in the blood, like when let's say somebody has got typhoid, for instance, you can find infection in the blood itself. And of course, yes, if you don't treat it, you get into trouble. Any infection, urinary infection, gets into the blood called septicemia, and they can lead to disseminate, the infection spreads everywhere in the body. So I think, but you would be very unwell. You would have fever, your blood pressure would be low, your pulse would be high. Sepsis is a very serious condition that requires hospitalization generally.
Okay. This person says, good night, Doc. When there is a ball in your stomach, what is this? Thank you, please. So this person is probably feeling like a lump or a ball in their stomach.
Yeah. I would say that sounds like reflux. So the stomach... acid usually, so you have digestive acid being produced by the stomach, and the top of the stomach has got muscle that contracts and it keeps the acid in the stomach. Now when that contraction is a bit weakened, you can have acid moving up from the stomach into the esophagus, and that feels like a ball in the stomach sometimes. Even it can come up to the throat. Right. So patients will come and say, Doc, I feel like there is something in my throat, like a lump in my throat.
Yes.
And usually those are signs of reflux symptoms. Of course, also you can have gas that can present like a ball in the stomach. So you have movement of gas can cause that. But generally that is. Now, if you do have a genuine lump in your stomach or a feeling of a mass in your stomach, that is important, and that should be investigated. You should have a scan to ensure that it is not nothing cancerous, because we talk about lumps. So if you can have a feeling that I'm bloated, I have a lump in my stomach. But this is not a physical lump that you can feel or see in a scan, but you have that feeling as if it's a lump, generally it's reflux type of condition.
Doc, this next question. Somebody says here, good night, Doc. Can you explain kidney stone? Well, Doc, I could explain kidney stone.
I'd imagine.
I had one stuck in distal region, it was between, I think it was like between 8 and 12 mm.
Right. Yeah.
Right.
Yeah, that's
and that thing is the pain that I felt. I mean, my grandmother who had kidney stone, she said, son, may make so much picnic, but I never experienced this pain. So you have a call coming through. Let's take that.
Let's see if that's it. I mean, I'm not quite sure. One sec, let me just see. Hello? Okay, good night. Yeah, I'll put you in speaker. Sorry, I just want to make sure it was a call related to this. Yes. Can you hear me now? Yeah?
Yeah.
All right, so you're calling regarding the show, is that right?
Yeah, I was the guy that for the numbness.
Oh, okay, right.
Thanks for calling,
yeah, thanks for calling. So you're talking about, a couple of things I would need to know regarding the numbness. So first of all, how old are you? Approximate, you don't have to be exact.
I'm 54 plus.
All right. And you've been getting numbness where? In the hand, the arm, the leg? Just tell me a bit about the numbness.
It's there in my leg going down to the ankle.
So, okay, so your leg is from your knee down
to my shoulder.
Okay, let me get this clear. So you're talking below your knee. So from your knee to your ankle, you get a numbness.
No, they're from my leg. Actually, from my hip goes all the way down to my ankle.
Okay. So that's
most of the time in my leg.
All right.
So it is a tie.
Yes, so the thigh area going down to your leg. So that is one. And one side of the body, right, left? What would?
Yeah, one side, the left side.
And how long have you had that?
Well, I have it couple days now, like 2-3 days.
So the most common cause what you're describing there is an irritation of a nerve. It could be the sciatic nerve.
Yeah.
So you may have something called sciatica. You will probably need to be examined. Have you had this before?
Yes.
So you've had it before. Do you have back pains at all?
I had, but it eased off.
And have you had a scan of the back to check if there was any trouble, any trapped nerve in the back? Have you had a scan for that?
No, I didn't.
Right. Okay. And do you get this all the time, or it comes and goes?
It comes and goes.
And do you have any weakness whereby you can't move your ankle, or do you feel any weakness in your leg?
No, I don't feel weakness. I just feel the numbness.
Yeah. So I think it's a nerve irritation. What you're describing there sounded like sciatica, and it more than likely it's a nerve irritation. Majority of times it tend to resolve with pain relief and rest and muscle relaxant. So there are medication we will give to relax the muscle and rest and pain management. And most of the time you'll get better. But we need to establish the cause generally. That would involve you having an MRI scan of the back. So the nerve, depending on the examination findings, so when I examine a patient for sciatica, I will know if the irritation is coming from the back. Mm-hmm. Also, you can get irritation anyway along the nerve, in the buttocks, in the thigh, going down there, the nerve can be irritated. So depending on the location of where the irritation is, we will then decide what to do. Now, you are relatively young. Do you think this came on as a result of trauma, that you have lifted something or you have strained yourself in any way?
Well, I had fallen a couple years ago, and I felt it had came from that.
So it started at that.
I had another accident where I had a 2 broken ribs, laceration to the liver, a swelling lung. It's actually like I went to the grave and come out back, and
Oh, sorry to hear.
it's raising up now again.
Yeah, so it can be related to that, but I would expect you would have gotten symptoms at the time of the injury if it was injury related at that time. The thing is, after a while, sometimes you have a bit of arthritis in the spine, and that can trap the nerve. You can also have a bulging disc. In between the spine, you have some cushion, they're called disc, intervertebral disc, and they can bulge out, especially if you lift heavy weight. It can cause bulging of the disc. So I think you'd have to be examined for us to establish that and maybe have a scan. Now, regarding your arm, you said this numbness is where?
In the wrist area, wrist and the fingers.
Right. And if you were to bend your hand downwards, like I'm doing on screen here, do you feel the numbness?
Yes.
Well, it sounded like you've got carpal tunnel syndrome. So in your wrist here, there's a nerve called the median nerve, right? And it gets trapped. The nerve goes on the sheath. And if the sheath is too tight, it traps the nerve. And you will have numbness in your finger. So, but it usually spares the little finger. Would you say to me that the little finger is not affected, or is the little finger affected?
Yes, the little finger are affected.
Is the little finger affected or not affected?
Yes, it's affected.
It's affected.
All right, so if it is affected, it's very unlikely for it to be carpal tunnel because the medial nerve doesn't supply the little finger. So you could have it from the ulnar nerve, a different nerve that supplies the whole hand, that part of the hand. Now, I think, just tell me, you said these symptoms you're getting for how long now?
It's like about 2 or 3 days now I get in the symptoms, but I used to have it years ago.
Oh, so you had it and it went away and now it's coming back.
Yeah.
And besides that, do you have any known medical condition, any diabetes, any other known condition?
Well, not to my knowledge so far. I have no complaint.
Oh. Well, I think you probably would need to be examined to establish a bit more detail. So we will do what we call, a neurological examination to check the nerve. Because usually what you're telling me sounded like a nerve issue. And the nerve can be trapped somewhere along the line. So see your doctor and you can discuss that. And, of course, the idea is to rule out other causes and to try to pinpoint where exactly the problem lies. And then we can discuss how it can be managed.
Okay, now.
All right. Thank you so much. Thanks for calling.
You're welcome.
Take care. Cheers.
Betty Chris, watching out of Toronto, our condolences to you. She said her Dr. Sam, my granddaughter, passed away.
We're the 27th of October.
27th of October.
Yeah.
We're sorry.
My sympathy.
Yeah.
And it's a difficult one generally when you're dealing with cancer because it's very traumatic when you come to the end of life. So may our soul rest in peace and yeah.
Yeah, anyway, so back to kidney stone. This person said, good night, can you explain kidney stone? Well, I could tell about the pain only, but you explain from a medical perspective.
Well, there are various causes. Kidney stone can be related. There are the various causes for kidney stone. There is a genetic predisposition and is a metabolic system of our body, how we metabolize calcium and urate. They're different. So what we tend to do for stones is if we were to extract the stone, we will then analyze the stone and see what type of stone it is. And then we'll know what are the causes of that type of stone. Okay. Right? So that's an important aspect to it. But let us look at, when you have a kidney stone, what do we do? How do we manage it? And what are the symptoms? So classically, as you said, pain is the hallmark of kidney stone.
Yeah, pain in the back.
Yeah, so you'll
unbearable pain.
Exactly. So you'll get pain around. So the kidney is higher up in the back, and it goes down the urethra, we call that, into the bladder. And from the bladder, there's another tube called the urethra, right? So the stone can be it will be from the kidney into the urethra and into the bladder, just by the neck, by the opening of the bladder where it joins, right? Because if it's in the bladder, you probably wouldn't have symptoms. You'll pass it out because the bladder is huge, right?
Yeah.
Now, as a stone, so a couple of things can go wrong. So the stone can be sitting in the kidney and it does nothing, and you wouldn't even know about it, and it's just there. And if the stone is less than half a centimeter, generally, we would probably leave well alone if you're not having any symptom from it. And usually you find that incidentally. Now, if the stone moves, if the stone is big, of course, you don't want to treat it because it can cause problems. Now, as the stone moves down, you will have pain. And of course, as you say, it is described as the worst pain you can experience. So the pain generally we will describe as what we call loin to groin pain. So it moves down like that. And of course it can radiate down to the testicles or the groin area as well. You can have blood in your urine because classically as the stone travels through the passage, it bruises the area and you pass blood.
Yeah, I've had that is exactly what happened to me because not just blood during it was bleeding profusely at times because when I look at the stone, it looks like like shards of glass.
Yes,
this thing is just crystallized together. So
correct,
it's cutting coming through.
Yeah, no, absolutely. And then, yeah, of course, so what we'll do, we'll manage it. So if you have blood in your urine, so the idea there is to manage your symptom acutely. So pain management, lots of fluids. There are times if the stone is small, you can pass it out naturally. We will give you medication to relax the muscles and open the passage. And you can pass the stone out. There are also some medication that can help with dissolving stones. Then the evidence on that is very, very weak that, you may have to use it for a long period of time. But the management generally would be surgical depending on the size of the stone. So, but importantly, if the stone goes and it blocks the flow of urine, that's an emergency. Because it can cause, if it blocks the passage where the urine coming through on one side, it blocks there, no urine flowing, you have backflow, it causes swelling of the kidney and it can damage the kidney.
Right.
So that's a very important thing to understand, and something you wouldn't even know because it can damage that kidney from something called hydronephrosis.
Right.
The kidney is swollen, the urine is backing up in that kidney, pressure is high, and you damage the kidney. So you might still pass urine because the other kidney is working. But you'll get pains and you'd realize that. So if we suspect a stone, I would normally always scan the patient to ensure that there is no acute obstruction due to the stone. So depending on the size of stone, they can go and do shockwave therapy where they break the stone up and you pass it, or they can go and put a tube in and do surgical extraction.
One of the things that I did immediately after that having that stone, is I started to drink a lot of water.
Yeah.
Is it the best thing to do to
avoid? It is the best. Well, of course, if your urine is concentrated and there's a tendency for stone formation, it will happen more if the urine is concentrated. So, of course, it is very important to encourage drinking water. So I would definitely do that. There are times when drinking a lot of water also would prompt you to pass urine, and you can pass the stone out.
Right. Is it a calcification process happening?
Yes. So it is a calcification process because this stone is made up of minerals. And, depending on the cause, calcium, you can have calcium stone, you have oxalate stone, you have, different types of compound in the stone. So depending on...
That's the last thing I want
uric acid,
anyone to have.
stone.
I'm telling you, Doc, I don't know if they got any other pain worse than that in the world. Kidney stone, my goodness. All right, I have another question here. What is the best thing to do when the body is regenerating new blood vessels?
Well, the body has a natural mechanism where, let's say, the heart, it generates collateral circulation, but generally, the body it regenerates when it is healing, in that healing process. But it's a difficult. I'm just trying to get some more clarity. What I mean by the body, as you grow, your blood vessel will grow and your tissue perfuse in that way. Yeah. But it's.
The question is not quite complete.
Yeah, I suppose it's that's a different one.
This one here, I'm having a burning and tingling feeling in my left thigh. Can you tell me what causes
Morning
that?
things in my left. Again,
Is
that's on the nerve, and
yeah,
sciatica can
sciatica,
be
yeah.
the common cause to that.
Yeah.
H. pylori reading what? 411, alarmingly high. In 2 weeks of antibiotic enough for treatment. Is it 2 weeks of antibiotic enough for treatment? Yeah. So H. pylori, that other question talks about.
What is H. pylori though? It
So-
seems to be a common thing. I hear a lot of people saying that they got stomach issue, that they go to the hospital. What is with the stomach issue? H. pylori.
So H. pylori is called Helicobacter pylori. It's a type of bacteria that lives in the stomach, and it increased acid production. It can give rise to peptic ulcer disease. So you get more production of acid. You have burning, like ulcer in the stomach, and also it increases your risk of even stomach cancer from ulceration. So it is it is treatable. And it consists of a course of antibiotics. They have just published some data on H. pylori and drug resistance and treatment. So that person is asking if 2 weeks of antibiotics adequate. And yes, the current guidelines suggest that we treat for 2 weeks. Initially, in some guidance, they tell you 1 week of treatment. Now they're telling you 2 weeks of treatment, and they have different regime protocol as to how do you manage it. So we tend to use something called triple therapy. So we'll give you 2 antibiotics and anti-acid medication. So that's called triple therapy. You can also, so that's a first-line treatment. You can also use something called quadruple therapy. That's 4 types of medication. So different types of medication. And then you have a set of antibiotics we use first line. The evidence tells us that in first treatment, it probably takes away 80%, cure 80% of patients. 20% of patients can have recurrent infection, or they have resistance to that set of antibiotic. Then we go on to give what is called second-line treatment. Now, it is very important. I want to make this point, and I see patients coming back sometimes. They have had, so the test for H. pylori, there are different tests you can do for H. pylori. You can do a blood test for H. pylori. So what the blood test does, if you have an infection, the body produces antibodies to fight that infection, and you get that antibody in you. Now, that's one. You can do a stool test, checking for the bug, and you can do a breath test. I suppose
Let's take this call, yeah.
Okay.
Good evening, caller. You're live on air. Ask Dr. Saw.
Yes, good night.
Good night.
Good night, doctor.
Good night, yes.
Yeah, I would like to know if bicycle can provoke prostrate.
If what, sorry?
Riding a bicycle can cause you to have can give you prostate issues.
Provoke
the problem.
Yes. Well, yes, it can provoke the problem. So riding can cause trauma. So if you're sitting in a hard saddle and your prostate is just below that, of course, if you already have an enlarged prostate or you have an infection of the prostate, you tend to have anal pain. So it can bring out the symptoms more, but it is not the cause as such. So I wouldn't think that prostatic hypertrophy is as a result of riding by the bicycle. Do you understand?
Yes,
so
if you
already...
Why I asked you this, I had a problem with the enlarged
prostate. Yes.
I went and operated on it.
Yeah.
And after 4 months, I was riding a bicycle, and I realized that it started paining me. So what I did, I tried to make some research, and when I go back, I realized that my father had a problem.
Yeah.
He used to be riding bicycle.
Yeah.
My uncle had the problem. He used to be riding bicycle. My brother had the problem. He used to be riding bicycle. And me is the same thing. I used to be riding bicycle. So I just come to a conclusion like the problem a little bit.
I wouldn't say that. I can't tell you offhand. I'll have to look at that evidence specifically.
The only one in Nova is Lance Armstrong. One, right?
But I don't think that the bicycle is a cause for the prostate to be. So your prostate was just enlarged, nothing cancerous, right?
So mine wasn't cancerous, but my brother was cancerous.
Yeah, but you see, yeah. So the enlargement itself, I mean, trauma, I suppose, multiple trauma as a result. Were you riding leisurely, or are you an athlete, a cyclist?
At least I ride for 3 years. I ride from Velodrome to Rosignol. It is about
Oh,
24
yeah,
miles.
that's a long way.
That's a lot of
Every day I used to be riding going.
I mean, yeah.
excessive. Yeah.
I mean, it's difficult. I don't have the evidence that I can conclusively tell you that bicycle riding, I have to look at the papers and look at some research to see if that is substantiated. But on a level of just, looking at it, it can cause trauma to your prostate, or it can make your symptoms worse. But I can't say conclusively that is the cause. And I would have to look at publications and data on that for me to give you a specific answer.
All right. Thanks.
Okay.
Thank you so much.
Good night.
Yeah,
Thank
you
you.
too. Thank
Good
you for
night.
coming through. Doc, we got time. I probably got to deal with one more question because we're rapidly running out of time. We got 2 minutes to go.
I was going to make a point on this H. pylori for patients
Yes.
to say. So the H. pylori test, when you have a positive blood test and you are treated, the second test to check if you've got persistent infection is not a blood test, because the blood test stays positive for a while. So if I test you again second time, looking at the blood test will be positive, but you may not have the infection.
Okay.
So I see these patients come to me lots of time and say, Doc, I've just repeated the blood test and it still show positive. But yes, it will stay positive for a while. So I would normally tell patients, for you to know if the bug is gone, you then have to do a breath test where you blow some into something, or you do a stool test, or when they do a camera, they normally can take a sample and test it directly. So I think that's
Doc, we got 2 questions here. Just see if we can get these out quickly for me. We're gonna probably deal with them again next week.
Yeah.
When you take metformin, you have to take a high blood pressure tab and cholesterol tab together.
So definitely that's not the case. So metformin is independent of your blood pressure and your cholesterol. But most people who get diabetes, they also probably have high blood pressure. They also have high cholesterol. So when we look at patients, so metformin is for diabetes. It's a diabetic drug. We also give it in some patients, so women who have got something called polycystic ovaries, where they have insulin resistance. But generally, it's a diabetic drug. So just for clarity, you do not have to take high blood pressure tablet or cholesterol tablet if you're taking metformin. So that's not the thing. However, most people who have got diabetes also have got high blood pressure.
Right.
They also have got high cholesterol.
Yeah.
And, it's a metabolic thing. And they may be in blood pressure tablet and cholesterol tablet and metformin at the same time.
All right,
So
last one here. I'm having a pain under my foot, exactly by the heel. Getting off the bed in the morning to walk is horrible. I feel is sticking there. Doc, can you please shed some light on
So
this?
looking at that, I would say to this patient, to Rafi Armila, this is classic 100% plantar fasciitis. Remember we talked about a condition? So she described a classic symptom. You get up in bed in the morning, as soon as you press your weight, step on it, you feel the pain. And that is a condition called plantar fasciitis. If you look at one of our previous episodes, would it be the first one?
Yeah, when we look at the foot, right?
Yes, where we put the foot and we look at the arch and where the fascia. So at the bottom of your foot is like an arch, and you have a sheet at the bottom called the plantar fascia. It's attached to the heel and to the front. So when you rest and you wake up in the morning and you go like that and your body weight comes on it, your body weight does that. So it pulls the back of the heel, and that is called plantar fasciitis. I would like you to Google it, plantar, Plantar, fasciitis. Now, there are some exercises you can have a look at. Do some of those exercises, stretching exercises and rolling pin under your foot. painkillers. But if you have access to therapy called shockwave therapy, you see a physiotherapist, and there is something called shockwave therapy that you can use that is quite effective for that. But that's in summary.
Yeah, well, we're out of time. Doc, it was a wonderful show tonight. We had quite a lot of questions coming through. And we want to thank you, the viewers, for sending your questions in and being here with us tonight, because without you, the show would not be what it is. We encourage you to spread the word around about this show and let everyone know about the show, and it's happening every Tuesday night right here on this platform where you can ask Dr. SAW. So again, Dr. SAW, it was a really good discussion tonight. We look forward for us to do this again next week.
Absolutely.
Right?
Thanks a lot.
And to everybody out there, as I always tell you, be careful on the roadways. If you got to get over the bridge, it closes at 12 tonight, and it's going to be closed for 4 hours. So make a dash for it. Remember, be safe on the roadways and stay healthy, everybody. Take
Lovely.
care.
Thank you. Good night.